There is a reason why when I show you all the cases of hair transplant results on my channel, I always make it a point to show you the scalp donor area. And when I counsel patients before the hair transplant, I also make it a point to explain to them the quality and the quantity of grafts in the donor area. And this exercise is important because it instills respect for your donor area, the donor area limits. Patients actually deserve to ask, how many grafts will I be leaving behind after this procedure? What if I need more grafts in say 5 to 10 years? These are not merely meta questions. They are the essence of a successful hair transplant, a hair transplant that will last a lifetime. A successful hair transplant, after all, is not merely a head full of hair, but a restrained harvesting without wasting grafts that may be needed in future. Like in this case, Anil's hair transplant result after 6 months. And contrast this with Rajesh, who went to Turkey for his hair transplant surgery. Six months after his procedure, he watched his reflection in the mirror with a smile. A respectable density had emerged all over his scalp, and to any observer, this would seem like a triumphant outcome. Mission accomplished. However, 1 year later, he walks into my clinic, completely shattered since the baldness has progressed immensely. And as I examined his donor, I feared something essential had been overlooked. Hair restoration may yield volume, but its true merit lies not only in superficial fullness, it lies in mimicking natural growth patterns while preserving the precious donor area. When hair loss is addressed merely by cosmetic density, one misses the forest for the trees. After all, hair transplant is not curative for androgenic alopecia. It is merely a palliation, a filling in the blanks with strategic reallocation of relatively permanent follicles taken from the safe zone of the donor area. And yet the heretofore unseen issue of overharvesting keeps patients bound to a future in which baldness may resume again unabated, and when donor reserves have been exhausted by a cowboy clinic in a misadventure, there is hell to pay. As the bitter reality of overharvesting unfolds, increasingly we are hearing stories of technicians who harvest an excessive number of grafts which are not required, say 5,000 grafts, many say even 8,000 grafts, and only to utilize the best 3,000. Can such largesse be deemed ethical when it leaves the patient severely depleted in the donor area? Understanding why this issue is so troubling begins by understanding the limits of the donor zone, also called as the safe donor area. This site, the safe donor zone, comprises follicles that are genetically resistant to androgenic alopecia. And once harvested, these follicles do not regenerate. These follicles, when utilized optimally, support the present hair transplant, but are also useful as a reserve for future procedures as baldness progresses. And if extraction surpasses a conservative limit, typically between 35 to 40% of the donor area's baseline density, the results can be medically and aesthetically detrimental. Exceeding this threshold often leads to visible thinning, scarring, and a reduced capability for future graft availability. Although FUE is often marketed as a non-invasive, minimally invasive procedure, it leaves thousands of micro incisions. And when these are made to accumulate one on top of the other in a greed for graft numbers, the donor area takes on a moth-eaten appearance, thousands of tiny scars merging into one, causing patchiness, causing shock loss, causing unesthetic, unappealing look. In short, the donor area is a finite repository. Careful conservation, not maximal extraction, is vital for both immediate appearance and long-term options. Rajesh's case was emblematic. At first look, his front was extremely lush, but behind the scenes, the donor area had been ravaged beyond recognition. Worse still, many clinics sanitize this process. Technicians harvest hundreds and thousands of grafts, pluck out the best, and discard the rest, unneeded but take nonetheless. And this dynamic raises some serious questions. Is it right to use a patient's donor area as raw material for trial and error, getting the best grafts? Commodifying grafts just to meet exaggerated quotas? Definitely not. When these extractions, these decisions foreclose future options and leave the scalp shocked over harvested. Let us not for a moment forget the inexorable progression of baldness. Androgenic alopecia will most likely continue even after hair transplant, because a hair transplant does not stop genetics. Hair transplant does not inhibit DHT, and that means that restoring hair once is not enough, especially when you have had your first procedure at a young age. So it is extremely crucial to anticipate future requirement of graft. Without conserving a portion of your donor area now for future use, patients face the double tragedy of renewed baldness, aggressive baldness, and inability to fix it. And this is why viewing hair transplant as merely a palliative procedure makes clinical sense. And this brings us full circle. A hair transplant is not a triumph when it destroys the future. It is a short-lived Pyrrhic victory that risks eventual defeat. A truly successful hair transplant would emerge gradually, natural direction, natural density, donor area intact, with the possibility of future reinforcements as hair loss progresses. Anything less is purely cosmetic expediency, not scientific excellence. So next time you see a 6-month great result, I urge you, look deeper. Is it natural? Is the donor area preserved? Was every graft used with a purpose? Or was the patient's scalp a stockpile from which the best grafts were plucked out? Let these questions guide your research while you look for a hair transplant procedure. For a hair transplant procedure should never kill the goose that lays golden eggs. So thank you for watching. If you haven't subscribed, please do. Your encouragement keeps the channel going. Have a nice day and God bless you.